So good afternoon, everyone. Thank you for coming to our next session on the engagement and disclosure issues for victims of elder abuse. And we're pleased to have with us David Burns, who is the Canadian Research Chair in Older Adult Mistreatment Prevention, and he's also an Associate Professor at the University of Toronto in the Faculty of Social Work. I know he's got an extremely busy schedule, so we're so pleased that he's able to join us today to share his work that he's been doing. He's done lots of research around elder abuse, including collaborative with some of our keynote speakers today, including Jennifer and Peter and Tony. So we are kind of a small world when you think about some of the work that's being done to address the prevention of abuse and looking at this from a research perspective. Just to give you a little information around David. David is, as I mentioned about his work, he's completed his PhD at the Columbia University at Social Work in New York City, concentrating in gerontology and advanced practice. His program of research focuses on issues related to elder abuse and ageism, including the development of basic science and interventions to prevent the mistreatment of older persons. He has advised major international organizations on these topics, such as the World Health Organization, National Institutes of Health. He advises on different levels of government and non-profit organizations, such as state-level adult protective services programs, on the development and implementation of elder abuse support programs and prevention strategies. So without further ado, I will turn it over to David to do his presentation. David?
Thanks so much, Ryan, for that very kind introduction. And it's really, really nice to be here. And I can't see you all, but I trust that you're out there, and welcome you to this session. I hope you've been enjoying the sessions throughout the day. So again, thank you to Elder Abuse Prevention Ontario, Ryan and Marta for the invitation. Really happy to be here, and I will jump in because I believe this is about a 30-minute session, and I want to leave some room for questions at the end. So this talk is focusing on this issue of disclosure engagement. So it's sort of like risk assessment and screening measures and tools are extremely important, and I know that that's been a topic of conversation throughout some of the other sessions today, and there's a lot of exciting work going on in these areas. And I think a piece or sort of pieces that often are not given as much as attention as they perhaps should be given are issues around victim disclosure and engagement processes, which turn out to be sort of critical pieces within the overall detection effort, and certainly when we think about the early phases of intervention work with victims of elder abuse. That's what I'm going to be talking about today. So let's talk about just some broader statistics as we think about this issue of sort of disclosure and engagement. So it turns out that this whole kind of process of coming forward and seeking help and engaging with formal support services is a shockingly it's a shocking challenge. There's been a few, I would say, very good studies on this topic that have used large-scale population-based data, and most recent one I conducted in 2019. These are from the US. Unfortunately, we don't have this data in Canada, but I have found that these things translate quite well. Basically, when it comes down to it, only about 15% of known or identified victims living in the community ever come into contact with some formal support system, whether that's law enforcement, social support services, healthcare services. And so we have to keep that in mind, as I know many of you already know, is that most victims are highly reluctant, not eager to disclose or engage with formal support systems. And I would suggest that this may be, among, if not the biggest challenge we face when it comes to working with cases of elder mistreatment. And so I wanted to just kind of throw out this question here to you all. I know that many of you are working on the front lines and have direct interactions with older adults, or perhaps are in roles where you come across this issue, and just sort of ask you to throw in the chat, or I'm not sure if you're able to speak. Why, from your perspective, from your experience, why are elder abuse victims so reluctant to come forward or disclose their mistreatment situation to service providers? And when I say service providers, I'm speaking fairly broadly, but anyone kind of in a formal support position, whether that, again, that's social service programs or healthcare providers or law enforcement. From your experience, what would be the reasons for this?
David, I think we're just having a bit of an IT problem. So just continue on your presentation and we will hopefully get this rectified very soon.
Okay, are people able to hear?
That's what we're just working on, unfortunately.
Oh, okay. I should keep going though?
Yeah, just keep going because we are recording the session. So that will
okay.
It'll be up in like about 5 minutes, like not even that, couple minutes. We'll just get it going.
Rand, does it make sense for me to start again once people are actually able to hear?
Perhaps. Not sure.
Like has none of this?
I just noticed it. I'm just checking with. Oh, hold on. I'm just checking with my colleague to see if it's working now. So, yes, there's an issue somewhere on the IT part. I just sent her back the credentials. Sorry. Bear with me for a second, David. Going way too good. Oh, here we are. We're live now. I think we're slowly coming online. Yep. Okay. Do you want to start again, David? Sorry. Maybe we'll just push back by 10 minutes for Tony's presentation. So I apologize for that. I just noticed that the participants weren't coming, but they are joining now. So are you okay with restarting?
Yeah. Do you want to start from the beginning again?
Yeah, that would make sense. So sorry. So for people who are just joining us, we are going to start the presentation from the beginning. We just recognize that there was an IT issue. So David will start his presentation from the beginning. Thank you. I apologize for the technical problem.
Okay, no problem. So just want to start by saying thank you to Elder Abuse Prevention Ontario for the invitation. Very happy to be here. Rayanne and Marta, thanks for having me. And I hope you've all been enjoying the rest of the sessions today. We've got about half an hour or so, and so I'm going to move into the slides here, but please feel free to post any kind of questions or comments in the chat, or if you're able to speak out loud, feel free to do that as well. Yeah, my name is David Burns. I'm an associate professor at the University of Toronto, Faculty of Social Work, and a Canada Research Chair in Older Adult Mistreatment Prevention. My research focuses on both the development of basic science, like the prevalence and risk factors of elder mistreatment, as well as the development, implementation, and evaluation of community-based elder abuse response interventions. Recently developed and have been implementing and testing a response intervention called RISE, which has been a focus of my efforts for the last few years. Today, I'm going to talk about these issues of disclosure and engagement. And so I think there's been other presentations today on around screening tools and risk assessment, which are incredibly important facets of the overall effort. And there's really exciting work being done in these areas. I guess what I'm going to talk about today are sort of, I think, what are sometimes kind of missing pieces within this overall kind of elder abuse detection effort, namely the processes of disclosure among victims of elder abuse and engagement processes with victims of elder abuse, which is very important in the context of early phases of intervention. So starting off with some sort of broader statistics here, it turns out that when we think about kind of like the challenge of engaging victims of elder abuse, it's a shocking problem. So this is data that comes from what I would call really good data. It's like large scale population based data. This happens to come from the US. We don't have this data here in Canada yet, but I've found that these kinds of things tend to translate well. The most recent study was one that I conducted, and basically about 15% of known or identified victims living out there in the community ever come into contact with some kind of formal support system. So what I mean by that is like law enforcement or social service programs, healthcare services. So the vast majority of elder abuse victims never come into contact with formal support, and so that to me is I mean, it's a huge problem, and arguably, among the, if not the sort of greatest challenge when we think about community-based elder abuse response interventions is this challenge of engagement and of victims being willing to come forward and receive support. So as many of you know, I'm sure the majority of victims here are highly reluctant, not eager to come forward and disclose or engage with formal support systems. And so I wanted to throw this out because I know many of you are working on the front lines, and I'm sure that these statistics are not a surprise to you, but based on your experiences, or perhaps, whether you're on the front lines or you're in a role in which these kinds of issues come across your role, from your perspective, why is it that it's so difficult? Why are elder abuse victims so reluctant to come forward or disclose their mistreatment situation to service providers? Again, using the term service providers fairly broadly, whether that's in the healthcare system, law enforcement, social service programs. Interested to hear your thoughts. Just want to throw them in the chat. So further abuse if they come forward, shame, fear of retribution that is worse and more isolation, rely on the abuser. Yeah, these are great responses. Embarrassed, guilt, their fault, fear that they will be without help. Often family, friends don't want to tell. Great responses. Thank you. Fear of being abandoned by caregiver or abuser. Yep. Great. Just fear of outing themselves. Absolutely. Thank you for those of you who put your responses in. So I think you'll find that what I'm presenting here is I think resonates quite well with your responses you just gave. So some of the research that I've done is to interview victims of elder abuse using qualitative interview methods around this very question. So why is it so difficult to come forward? And you'll see that these themes really do, I think, parallel some of the comments you made in the chat. So afraid of perpetrator retaliation. Give you a moment to read. So these are in italics, the quotes that these older adult victims of elder mistreatment provided. You feel afraid that if you go and expose that person will hurt you. Embarrassment, shame, stigma. It's a huge theme that comes out of these interviews. I'm a very private person. I don't want anyone else outside to hear my stories because it's too embarrassing. didn't want to tell anybody. I didn't want anyone to know what's going on. Shame is a big thing. Knowledge and awareness. So I think just sort of if older adults in general were sort of more, if the issue of elder mistreatment was more sort of normalized and kind of people were more socialized to sort of be aware of it happening either to themselves as an issue or as a problem, or that they may be able to speak with their peers about what they're observing is happening. Family preservation and reputation was a huge theme that came out of these interviews. So people said, for the sake of my children, for the sake of my family's reputation, I stayed on. I think I made a big mistake there. I should have done something. But the person said, you don't know. You think your family is going to, you don't want to hurt the family. You want to try to live with that person if you can. And then some other reasons that sort of are often cited in the literature. Older adults experiencing stigma or distrust about becoming involved with, public or kind of government systems, particularly older adults from communities that have been historically marginalized or oppressed by these systems. People experiencing fears about what might happen to themselves. A huge one is this fear of, if I come forward, I'm going to be put in a nursing home. Fears about what might happen to their perpetrator, their alleged harmer. That person may, become involved in the criminal justice system or become homeless. Again, this idea of severing family relationships, or concerns about losing financial or social supports, losing their kind of primary caregiver. And then another big one is that, this concern that what might happen if I disclose? Will it set off a chain reaction of events that I have very little control over? Will I lose control in my life? And so when we think about the process of disclosure, sometimes there's a tendency among service providers to sort of kind of urgently insist that the person leave their perpetrator or to kind of enact other major life-altering actions. But this can be actually a serious deterrent within the disclosure process. So let's talk about disclosure a little bit more. So very little research has been done about disclosure, the actual kind of process of coming out among older adult victims of elder abuse. But much more has been done within family violence domains of intimate partner or domestic violence, or earlier life domains of child maltreatment. So a lot of this comes from there with implications for elder abuse. So how do we define disclosure? It's when an older adult who has experienced elder abuse informs a health or social service provider or any other third party. And as I mentioned before, it's received very little attention in the literature, yet represents, I think, a very important component within the overall detection effort. I'm just going to kind of throw out some things here that I think it's important to keep in mind, particularly for those of you who are working with older adults. So disclosure is generally conceptualized as a dynamic process that evolves over time, rather than as a discrete or single outcome event. It's not just something that somebody kind of decides, that just kind of happens in a single event. It kind of evolves over time. And this process typically involves a non-linear process that's characterized by stages such as, initially denial or even misportrayal of the situation to keep it behind closed doors, a reluctance to come forward. And then there's sort of these different phases of disclosure, including tentative disclosure, where it's not sort of a full disclosure, and then more of an active disclosure, which can often come under crisis circumstances. Not uncommon at all for then there to be a stage around kind of retraction or recantation of disclosure statements, and then perhaps coming back to reaffirmation. And so it's just important to keep this in mind. It can take place over the course of months or years, and most victims are in a state of denial or tentative disclosure rather than in a state of active disclosure. And I think this is really important to keep in mind, because when we think about, the different phases of sort of prevention that include like an initial kind of, when we think about like secondary prevention, and which often includes, screening measures, for example, and assessment, those forms of prevention are usually conceptualized as like brief, discrete events, like some kind of screening or some kind of risk assessment, which may not actually jive completely well with what we know about the disclosure process as being a dynamic process, right? In other words, the disclosure process may not be adequately facilitated using some of these, if a screening tool is really just meant as a single brief event. So other things to keep in mind about disclosure. It's hindered when clients perceive their service providers lacking time or interest or demonstrating discomfort. So victims are often attuned to their clinician's sense of comfort around the issue. Direct asking about potential victimization is important because it indicates a readiness to hear about it, but we can ease into these questions. So we can start with kind of sort of open-ended, innocuous questions like, how's it going with your son helping you out at home, or how have things been going since your grandchild moved back into the home? And then kind of follow these up, kind of steadily progressing into more focused questions, like how are disagreements or conflict handled in your family? What is conflict like for you at home? And just, again, to keep in mind that this whole process of disclosure may unfold over the course of several visits, and sort of taking all the good kind of direct practice qualities that we often hear about: compassion, respect, non-judgmental stance. These are things to keep in mind in terms of like how not to respond if an older adult does disclose their mistreatment to you. So it turns out this reaction is actually very important, and it may help kind of predict the future kind of behaviors and actions that the person takes. So one of the major barriers to disclosures is the fear of receiving a negative or stigmatizing reaction. So things like a reaction that might characterize the person in ways that might make them feel blamed or that might minimize the abusive experience. Conveying some kind of disbelief about their mistreatment or judgment for being in an abusive relationship in the first place, or failing, like, why did this take so long for you to kind of come out? These are things that would hinder, the propensity to disclose. Things to keep in mind about, that might actually be good ways to respond. Often victims describe how they're motivated by a desire for someone to listen without being told what actions to take. And I think that's hard for a lot of us when we hear disclosures. Sometimes our immediate reaction is to kind of move very quickly into action and what should this person do. Particularly with older adults, we have to be aware of kind of ageist interpersonal tendencies that tend to kind of direct older adults, kind of keeping these things in mind. Moving back to this kind of more generally this issue of help seeking, some findings that came out of this national study in the U.S. that I conducted or collaborated on with. This was with Ron Asciano and colleagues. It turns out that there are varying rates of help seeking based on the types of mistreatment. So, for example, physical abuse and sexual abuse, there are much higher rates of help seeking to formal support services than, for example, emotional abuse. And when we looked at factors that predicted help seeking, they were more, victims were more likely to seek help in scenarios that involve, as I said, physical abuse, polyvictimization, which means that they're experiencing more than one subtype of mistreatment. If their perpetrator had a history of police involvement. A really sort of big one is when the older adult victim had what we call a concerned other person in their life, someone in their informal social support network who was providing them with support. That third person really kind of helps enable help seeking. Things that contributed to a lower likelihood of seeking help among victims was when they were dependent on the perpetrator for daily activities, or when they lived with the perpetrator. I think makes sense. But some of the, I think, takeaway messages here is that help seeking is more likely to happen in more severe or egregious forms of elder abuse. So we think, physical and sexual forms of abuse, and that's not to minimize other types of abuse like financial abuse or emotional abuse, but These are the things that we were finding, as well as people who are experiencing multiple forms of abuse, or and then it's less likely in scenarios that involve some kind of dependence, whether that's living together or depending on somebody for care needs. We also ask victims of elder abuse, when we think about sort of the early phases of intervention, as we start to work with them, after a disclosure has taken place and we're starting to work with them to kind of support them and their case, what are some specific things that a worker can do to help you feel more comfortable in working with them? Because we know that, in addition to help seeking in general being a huge problem, we also know that once victims interface with formal support systems, dropout and attrition is another huge problem that services experience. So some of the major themes that came out of this, and some of them might not be like some of them are, I think, fairly obvious, but these things really need to be integrated into our intervention services. So this was by far the biggest, is that the older adult victims express that it's knowing someone is there for me to call, that I can call, that who calls me and who can check on me. And I'll sort of let you read through some of these quotes, but the overall sense here is that knowing that somebody is there, that I can always call, and that they're going to listen. Somebody who picks up the phone, somebody who I know I can call. This isn't really like, for example, a specific, therapeutic technique per se, but it's very, very, very important. Another kind of attribute from a caseworker that came across as very important was a stance that expressed kind of encouragement and strengthening. When I break down, being there to lift me up. The third quote talks about, just sort of, it's really hard to kind of acknowledge that your child or your stepchild is abusing you, and you kind of question yourself. Could I have done something differently? Is there something I should have done differently, or did I somehow cause this? And sort of, helping this person kind of realize that it is in fact abuse. Going here. Warmth and genuineness. So people very commonly express that it was really important when their caseworker really kind of came across as genuinely caring. It's not sort of phony, or it's sort of like it's my job, but it comes across as genuine, which again, may seem obvious, but for those who've been in these kinds of positions, and you're working with like a high caseload, it can be difficult to always sort of come across as genuine. I mean, you're busy, you may be dealing, as I say, with many cases and highly stressful situations, and this kind of characteristic, even if it is something that you carry, it may be difficult sometimes to convey that. Other common themes: connecting with tailored services, accompanying them to difficult experiences like court, providing information, and coming across, that there's a perceived effort being made. And I'm going to end with this slide, because I'm just looking at the time here. Ask, what are your experiences like in trying to engage victims of elder abuse? Is it, I know that it is a challenging process, but I mean, there are certainly behaviors and approaches that people take that I think facilitate this process more smoothly. Feel free to post these in the chat. Language or customs. So certainly one of the barriers that does come up is if a service is not being provided in a person's sort of first or primary language, it's extremely difficult for them to engage with that service. And So having culturally and language sensitive services. So Jenny Lynn says it takes time and trust, and I think that's I think this is a really, really important comment. You know, in the U.S., for example, all states have an adult protective service system, and our program that we developed called RISE was meant as a complement to that system, because most adult protective service systems are legislated to close cases within a certain period of time, usually somewhere between 30 and 60 days. And what we've found in RISE is that it actually takes much longer often to truly kind of gain that trust and develop a working, kind of trustful working relationship with victims of elder abuse. And you know, that's really important in the context of some, you know, response intervention. So I appreciate that comment. Reluctant to engage, absolutely. That you know, this is a population, a client population, who is typically very reluctant to engage, not kind of eager to engage. Clarifying confidentiality agreements often helps, absolutely. So being very clear as to, you know, what information is sort of safe to share with you without, you know, risk of some form of reporting. Again, Joanne saying take the time to build a relationship, absolutely. And you know, I can't underscore enough the importance of having a system of response that allows us to take that time to build a relationship. And if we can do it, you know, one of the key findings that we've found as we have been evaluating RISE is that they're less likely to come back into the system in terms of you know, this outcome of recidivism. And I think part of that is because it's you know, more time is taken to develop relationships, and sort of it heightens the willingness of clients to sort of engage with support services. Not knowing who to refer to for supports, I mean, that's a huge problem. I think particularly here in Ontario is that it's less clear where to refer somebody. You know, for somebody to come forward and disclose their mistreatment, it kind of makes sense that they would want to know that there's some helpful service that's actually, you know, going to work and that's supportive, and that is not certainly clear. Absolutely. So Catherine's saying oftentimes clients will come forward about elder abuse while working on other things, and that's a great point. You know, it often comes up, just as you said, when working on other things, and these other things are often a more appropriate kind of mechanism through which to kind of ask questions about potential elder mistreatment if you suspect that may be happening. Sometimes they're not always capable, and the abuser may be their legal decision maker. And those are extremely tricky situations. And my presentation here has really made the assumption that the older adult has capacity to disclose and has the insight to recognize what's happening. And so I think that's a really important point, you know, that it's a different kind of set of you know, things to keep in mind when we're working with clients who lack capacity. So I appreciate that comment. Thank you. So Jody Lee making hello, Jody Lee, by the way. Jody White. They've hit so many roadblocks from legal institutions. Why would I be able to accomplish anything? So I mean, if their experience with formal systems has not perhaps been very helpful, why am I motivated to sort of engage with another one? And again, I think we really have to think carefully about the way we design these systems of response and sort of, you know, for example, through a trauma-informed lens and sort of with engagement at the forefront of our designs, knowing that these are huge challenges. So Carla's talking about the systemic abuse and that it seldom gets properly dealt with. That's another huge issue, and perhaps ties in with Jody's prior comment that if their experience with systems, formal systems, has been abusive, then and certainly characterized by serious power differentials, that would be a huge inhibitor. Thank you. So I appreciate your comment, Maria, and sort of really highlighting the reality that many of our systems are, sort of centered around and built upon a value and belief systems that do sort of serve to further marginalize and discriminate, and that is a real experience that many older adults from various communities do experience, and that again, it's something we have to take very seriously as we think about the design of our response systems, and kind of learn from some of our other systems of response from other domains of family violence that we know have had kind of disproportionate case representation from certain oppressed communities. So I appreciate that comment. Unless there's other comments, that is.
We did just have one. There was one question, David, in the Q&A box. Just wondering, would be interested to know service providers have enough time to visit and follow up to support older adults who are experiencing abuse, because we often find that you have so much time in the day to get to the call, if it's a home visit, that kind of thing, to do that follow up, and that could be one of those barriers. And how do you have those conversations with someone when you don't have the time or to sit down and really engage in that conversation? So we thanks Bonnie for that question.
Great, that's a great question. So it sounds like Bonnie is posing that to those of you out there who may be in a position, and I see that, Rand, there are some answers. So Carrie's saying staff turnovers. I assume these are answers to that question. Staff turnovers, not sure who to call, love their aggressor so much. Oh, sorry, these are, I don't know, but never mind. Okay, does anyone have a response to Bonnie's question?
I think it's more like it also deals with some of those systemic issues. I think that maybe some other people have brought up in terms of, dedicating the time and resources so people can actually do maybe case management, to do that follow up and spend time with the older adult and the family themselves, and to engage and do some more of that. Not only the screening, but sit down and problem solve and work out and make some connections with those resources in the communities. If there's other questions, we have a couple minutes left for other questions. Or David, if you have any final kind of comments that you want to add?
No, I mean, I appreciate all the, these were great, comments in the chat. I mean, it's, I appreciate your dare I say, engagement here. So I just thank you, and I hope I get to meet some of you at some point. Enjoy the rest of the day.
Great. Thank you so much, David. And thank you for everybody for participating and engaging in the chat box. It always makes it a little bit more interesting to hear other people's perspectives, and it gives us an idea of what we need to do to, again, counter some of these barriers that older adults might be facing in terms of developing programs and outreach to support them, and having these dialogues to along the way with individuals that we might see that are at risk of abuse. So thank you, David. We are going to be going to our final keynote speaker, who's going to be starting in 1 minute. So if you want to switch over, that would be great. And thank you again, David, and our interpreters.
No problem.
Thank you.
Thank you.